There's a lot of worries that come with having diabetes.
When Britt Hancock was diagnosed with diabetes as a child, she had her parents' job benefits to cover the cost of her meds.
Knowing that my life-saving medication, life-sustaining medication is going to be there when I need it.
Now as an adult, her biggest worry is how she'll pay for the medication to keep her alive.
After graduating university, my number one concern wasn't where am I going to be employed, what job I'm going to have. It's where I'm going to find access to the medication that I need and the funds to pay for it.
It should not be this way. It should not be that Britt relies on the whims of having the right job and the right coverage to be able to live.
Outside the Banting Institute in Toronto, where insulin was invented more than 100 years ago, NDP leader Jagmeet Singh reaffirmed his party's demands for coverage of diabetes drugs and birth control as part of a national pharmacare plan currently being negotiated with the Liberals.
Those are the two things that are on the table right now that I can share with you.
The clock is ticking to get a deal done. The two parties are working toward a new goal of tabling legislation by March 1st, after a previous deadline was missed. Singh says the latest talks have been positive, but added the Liberals have not yet agreed to fully fund diabetes medications.
But I can't get into the details, but what we're looking for is real coverage.
Coverage that can't come fast enough for Hancock and so many others. A recent poll finds nearly 1 in 4 Canadians have skipped doses, split pills, or not filled their prescriptions at all, simply because they cannot afford it.
I think as Canadians, we sometimes think it's the kind of thing that only happens in the U.S.
The Council of Canadians says it's heard from people across the country who, even with existing coverage from work or a provincial plan, are choosing between paying the rent, buying groceries, or going to the pharmacy.
I think it's really a cross-partisan issue, and it's unfortunate that it's kind of getting tangled up in parliamentary politics.
The council is calling on the government to start with the most commonly prescribed drugs, which make up about 50% of prescriptions, then build from there. The office of the federal health minister would only tell me they continue to negotiate, but wouldn't be more specific about what the holdup is. For City News, I'm Caryn Ceolin.